if we could, this kind of leads into just that ritual. And you had last time we talked some good ideas or suggestions because, or, right now, the traditional rituals I'm imagining, I think of like the people in Italy and Spain and, that have had large amounts of death and have very age-old organized rituals, and they can't happen right now. Right. And so how do we, it's really, this whole thing is causing us to think out of the box in so many ways. Mm-hmm. And I think this is just another way of what do? You don't just call up the funeral home and and say, okay, here, mm-hmm. we're going to bring the casket or the urn or whatever. And we're going to have the service on this day with so-and-so. It's not happening.
Yeah. So what we're hearing now is, yes, because of the mandates that they can't do the traditional funeral where you bring it, or the visitation where you have multiple people coming to witness your grief and provide support to you. Again, this varies from areas of the country and to particular funeral services, organizations, but they have gone from, where they would call, even from calling the family in and sitting down and talking to them, to doing it over the phone. Even funeral.
Okay, so services over the phone, you're saying?
Well, even to get it set up. One funeral was talking about how they would bring the family in and they would offer them hot chocolate and cookies, and they because they're trying to provide comfort, and they can't even do that. Even the funeral industry is saying this doesn't feel right to us. Mm-hmm. We're not providing the kind of service we want to provide to families for their loved ones. They're having to do, like you said, out of this box thinking. And I remember the first time I noticed some funeral home was advertising that they were doing live streaming. I thought, oh my gosh, how impersonal.
Right.
And now you're going to be lucky to
get that. Mm-hmm.
So I think they're looking at, just having services just for the immediate family. And even with that, if you have a large family, you may not be able to do that either.
Right.
Or they'll just do the graveside services because you can be outside and further apart from each other.
Yeah.
We're going to look at different ways. And I also think there might be some value, particularly for communities that have a lot of death, particularly I'm not even going to say Corona. I'm going to say any death that happens during this pandemic that changes how people function, to have a community service, to bring together the community as a whole, that we've all had to change how we do things. And how we said earlier, you talk to mom and dad and they say, oh, I want this and I want this. And you want to honor that. But now you might not be able to.
Yeah. So, even little things down to mom wanted roses at her funeral sort of thing, the types of flowers or the messages that were sent. I imagine the messages, the liturgies and things like that could be sent via, using technology. But You're right, that really, so if we do have that image and that, okay, it was talked about and there's this plan, and then what do you do if right now you may not be able to implement those little things or the big things?
And I just think it feels so unnatural to all of us because this is not how we want to do things.
Right. I like that you've used that word a couple of times, and I think you're spot on, that description, especially in these kinds of rituals that are age old and, weddings and funerals bring families together, right? That's one of the phrases I grew up with, right? And so this is a moment when families come together, and they have for centuries in a similar way. And now we really, thinking out of the box, and that experience of it just feeling unnatural, right? Yeah. Mm-hmm. And yet there are ways to do it. And you brought up that nice example of even how a church service was going on. And I'm wondering if you have other suggestions. You had some other ideas last time we talked about some rituals, something you mentioned a blue Christmas. I was kind of curious about, and what
Well,
is that?
yeah, that's kind of going back to the community wide. The Blue Christmas, as my understanding, is done traditionally around the Christmas holiday,
Mm-hmm.
and the Jewish holiday too. I can't remember. It's starting before that, just so people that are normally that this is like a party kind of time and loving
Right.
time and family time, and you're grieving the loss of someone that you've lost this in the past year, is bringing that group of folks together to support one another during that
Mm-hmm.
time. Some other things that you could do is I read recently where someone's um, family member went by the nickname of Bear.
Mm-hmm.
So they did a teddy bear drive in his name
Right.
for
Mm-hmm.
a children's hospital. Um, my father was a farmer and had sheep.
Mm.
And so when after his death, we instead of getting gifts for each other, we gave our money to an organization that purchased sheep and livestock for third world countries.
Right. Yeah, we've done
So
that for Christmas stuff. Exactly.
yeah, so I mean, it's otherwise. I mean,
There's so many
trying to think
opportunities
of
to give here, possibly. Yeah.
right somehow to remember that person, to
Mm-hmm.
honor them, and to give back at the same time. I mean, or just like my grandmother's birthday is coming up, and she loved cherry nut cake, so I may make a cherry nut cake in her honor.
Right.
Or my father-in-law was a big 7-7 drink and a certain kind of fried onion rings. So occasionally when it's his birthday, but none of us like 7-7, but we'll buy the
Go to
drink
the onion
anyway,
rings, right?
and we'll eat the onion ring.
Right.
But it's different ways to acknowledge that person and their presence and how important they were in our lives.
Exactly. And I think that's the point here, isn't it? So, for us to circle back around, and both of us are like looking at our family memories, but the salient point is the value of having these little rituals, like you said, of the one thing you remember about the person,
Mm-hmm.
and being able to carry that on uh, for a while, or for as a celebration for the rest of your own life. Uh,
Mm-hmm.
it just depends. But the onion rings and the cherry cake and things like that. And you also mentioned, it makes you think, you had mentioned some cool things, like I think at your facility you said you did sometimes handprints of loved ones. Can
Okay.
speak more about some of those things, Bez?
Okay. So, depending if the family would like, we can try to make handprints, which is basically finger paint and
Mm-hmm.
putting their hand on a piece of paper, and then it has a saying at the bottom if they would like. You can't always say they look very professional, but immediately after grief, some people really like that. There's their hand
Oh yeah,
on a piece of paper. They can see it, they can touch it, um, and it brings comfort to them.
yeah.
Sometimes we've actually done it with the patient's hand and like the wife's hand overlapping.
Mm,
Sometimes we've brought, when there's children, young children, we've had them come in and put their hand with the patient's hand as well
mm-hmm.
to create something for the immediate that they can have, and it represents their parent. You can buy, if you know ahead of time, there's companies that you can get clay and you can make, they do this a lot for infants, but I've actually now started getting it for adults, and you can make a fingerprint and make it in a charm that they can wear as a piece of jewelry.
Right. Okay.
That you have to think ahead of.
Right.
Not all hospitals have that
Mm-hmm.
available, and of course there's cost to it. Using paint and a piece of paper doesn't cost much, but that's obviously costs you more.
Mm-hmm.
We've talked to folks about um, if there was a certain piece of clothing that was really important to that person that has died, if they can make it into um, a Christmas ornament, or if it's large enough, they can make not they can make, but maybe they can make, or
Have
they
it
can have
made.
someone else make like a teddy bear or a stuffed animal.
Right.
They can make quilts.
So I'm going to interrupt you for a moment, Deb, because I think these are fabulous ideas, but my brain goes into we're in a pandemic. And
Right.
how could people, I mean, would a hospital like such as your facility actually hold on to someone's clothing for a while? Or
I meant
stuffed
clothing that
animal?
they had at home.
They had at home. Got it.
Yeah.
Okay.
Yeah.
Yeah.
Because
So,
usually
I
when
mean,
they're in the hospital, they're in a gown.
right, right.
They
I
walk
guess where I
around.
was thinking of a nursing facility such as my mom, but I know,
Oh,
I'm imagining those things. Yeah. How do you like get those things in this stage? There probably
mhm.
isn't. I've been told they have a protocol, but you're right. It would be things that they already have like, at home.
Yeah.
Hmm.
Yeah. And those take time to make, and
Yeah,
find the people, and that kind of thing. Those are for as time goes on. It's just something that you can do to help with the bereavement process. Not
hmm
that you might do it right away.
exactly. Some of this takes time. I'm glad you brought that up. That because I was thinking as you were talking that maybe some people who are listening or watching, I wouldn't want them to be overwhelmed with, oh, great, this is another thing I have to do.
Oh, no, no, no,
This isn't
no.
at all. These are
Mm-mm.
just suggestions. And the first year of grief a lot is when a lot of this gets done over that year's time,
Correct,
right?
correct. Yes, that's a very good point. Yeah.
It's not something that happens immediately. Or just asking you a question like, we've talked about some of the components of grief and the importance of making memories and how we're having to think out of the box for rituals that normally help us grieve. And then there's this other thing that's, kind of floating around, and maybe some people are thinking about that often comes in a pandemic time or a time like this when we're anticipating people dying, and there's this experience of anticipatory grief. Is there anything we should know that's important about that, or just is it valuable just to note it?
Well, when I think about anticipatory grief, um, I kind of think we're all as a country in
Yeah.
that right now, because we are anticipating people dying, and we are anticipating, and we don't know if it's going to be someone that we know,
So
someone in
true.
our family, or just our community. And so I think we're kind of, as a nation, as a country, we're in that phase.
Even as the world, probably, huh?
Yeah.
Yeah.
Um, in a world that isn't kind of not, um, and we're not used to this being so, all the word I can think of right now is massive.
Yeah.
Um, but when it's, when you have someone in chronic illness or a terminal diagnosis, you can see their decline, and or a dementia, you can see the decline happening, and you grieve those losses as you see them happening. And I
Yeah.
kind of think of that as anticipatory grief as well. Um, you experience, the grief of the physical symptoms, and, like the headaches and the backaches and the stomach aches, and then sometimes, or the chest, and it's pain, and it's the anxiety of fearing something that's going to happen that you don't want to happen.
Right.
So
Yeah.
that whole you're losing. I mean, with grief, it's the loss of something, and we've lost the way we work, we shop, we
Yeah.
communicate with people. There's so many things that we've had to change.
Right.
I keep hearing, I'll be happy when we can go back to the way it was before.
Hmm.
And then I hear, oh, it's never going to go back to the way it was before. So it's just that uncertainty right now
Hmm.
of what we may lose and what we may get to keep.
Exactly, because in those two statements, there's truth in both of them, right? They're
Right.
a little they're one or the other, but the truth is that when we go back, some things will be the same as before, and other things won't return to the way they were before,
Right. Right.
right? And we just don't know what is what. And
And that the one thing that you said that I thought was really interesting is like, we didn't expect it, and all of a sudden I have to make all these changes, and the world still moves on. And that's kind of what grief is. I mean, the death happens, you don't want it, your life changes, but the world still goes on.
Right.
And you have to figure out how to continue to live with the changes in your life.
Absolutely. And part of that world that's going on is the whole process of life and death, is the whole process of us, still needing, for example, dental appointments, medical appointments, having to go to the hospital.
Mm-hmm.
We still need electricity. We got to pay the bills. If we don't
Right.
have suddenly have a job now, how does that all continue to go on in this
Mm-hmm.
in this space of the pandemic,
Mm-hmm.
right? And so as we're talking, and I don't want to get into all the layers of it, but there's a certain level of grief that's going on for many things, not just for our loved ones, right?
Right. Right.
Yeah, yeah. All right. Well, is there anything else you want to add? I mean, I really liked you went through, as far as just from the basics from the beginning of what do you do when a loved one is in the hospital, and the 4 steps on how to find that contact person and get that. And then really nice nugget there about how do you say goodbye, and sometimes it's one-sided, sometimes it's in a letter, but to make sure that you tell them that you love them if you're able to, and the forgiveness both ways if possible, and the thank yous and the goodbyes and appreciations is tremendously valuable. And some really nice ideas of how, and the value and the importance of how to prepare oneself for the inability sometimes to make a visual assessment either of your loved one as they're going through an illness process. And they may look very different now than they did a month ago, right?
Mm-hmm.
And
Right.
then how and the value of using technology in those situations to try and get a visual assessment when some hard decisions need to be made, and importance of trying to have, if you haven't had them, to have some of those hard conversations or difficult conversations,
Right.
whether it's being on life support or whether it's, gosh, we're in this time and we don't know what your funeral is going to look like. What do you think, mom or grandpa, if they're able to say something to the difficult conversations of the saying goodbye to your loved one.
Right.
Yeah, you covered a lot for us. I appreciate it. Is there anything else you'd want to add to any of this as we talked?
No, I don't think so.
Okay.
I mean, I'll probably think of something after we hang up, but
Right, isn't it the case? Okay. Well, I really, I want to thank you for your time. And once again, this is Deb Palmer. She's a licensed medical social worker. She's been doing it for 25 years in Missouri with terminally ill. And myself, I'm Elizabeth Dondanell, a licensed marriage family therapist, and I am here with a clinical group practice of East Bay Center for Anxiety Relief, and we're here in California. I just wanted to bring this and put this out on Facebook and LinkedIn and a few places to people. I thought this conversation might be helpful for some. I know these are questions that were myself and, other people are starting to grapple with, the long distance, or just how do we grieve in this time of pandemic with our loved ones and some of the complications that brings. And so I hope that you find this helpful as a viewer, and if you like it, give us a like. If you have any other thoughts or ideas how we might further some of the information to get it out there and you found this useful, please let me know in the feedback box there, and I appreciate that. Thanks.
thanks.
All right.